to you what we're doing. I'm going to put another laser over your neck here just because we want to just dose the area. So this is called a cold laser, which is also known as a low-level laser therapy. So laser research has been in this country for about 50 years, right? So it was in Germany and Russia a lot longer. It just took the Americans to decipher it a little bit longer, but it's been in this country for 50 years. If you go to pubmed.gov, which is our National Library of Medicine, and you type in low-level laser therapy, you're going to now see 10,000 publications on the efficacy of this technology. So it's been around for a long time. The company, the laser that I'm lasering you with, is called Erconia. They were the first company in the world to actually gain an FDA clearance, and that was in 2002. And they've been making and manufacturing lasers for over 30 years. They're American made. They're right there in South Carolina. So what is happening when we put this laser, which is, this is what I'm doing. If I laser your hand, you're not going to feel anything. But if you look and see what these cells are doing, so there's a picture of a cell. Every cell in your body, every cell in my body has a job to do. That could be brain cells, soft tissue, bone cells, nerve cells. We can make your brain cells work. Yeah, we're doing a lot of studies on the brain. Yeah. So if you look at what cells need to function at an optimum, they need energy, and that energy is called ATP. So all of our cells, brain cells, soft tissue, bone, nerve cells, liver cells, heart cells, all these cells need energy, and that energy is called ATP. We have, the way that the cells make this ATP is through an organelle called mitochondria. Mitochondria is the battery to our cells, and our cells have thousands of mitochondria. So what makes mitochondria healthy is when we were newborns, our mitochondria was healthy. But as we age, so aging creates a little bit of a dysfunctional mitochondria.
Am I turning my head too much?
No, you're fine. You can turn, yeah. And so exercising, eating healthy, whatever we do, like taking vitamins, because we can't, get those vitamins from food anymore. So when we can make the battery work better, we're going to bring energy back to injured cells. So we want to make this guy work good. So what we're doing, if we look at this picture here, our lasers are influencing the mitochondria, which is this guy, to bring energy back to injured cells. And we do it very effectively. And when we do that, we can create homeostasis within the body. We can get those cells to we're supercharging. A lot of times doctors will say we're supercharging the mitochondria. And we can do it very effectively, meaning after one treatment, we can make your pain better. We can make your range of motion better. We can make your muscle strength better. So what we're going to do after we do this treatment is we are going to check your range of motion. We're going to have you go through that range of motion and see if we've made anything better. Sometimes healing takes time. So if we don't see any changes right away, I always tell the patients, pay attention to the next hour to 2 hours after you leave the office, because we've supercharged this. So sometimes it takes an hour to 2 hours, 24 hours to 48 hours. But multiple laser treatments are beneficial for the healing process of tissues. So on average, we try to have the patients come in up to 10 treatments. That could be 2 times a week for 2 to 4 weeks. So we want to try to get at least up to 10 treatments on you, because each treatment builds on the last. So some of the cool things that we're doing now, just so you can kind of see, there's the mitochondria. We make different wavelengths. Those different wavelengths also are very energetic outside of red. Sometimes we think of red lasers, right?
Right.
But we actually make a violet and a green laser, and we have that on the back of your neck as well.
I had green and I had
Oh, you did?
red.
Oh, okay. And we're pending FDA clearance for the use of our lasers for autism. Isn't that amazing?
That is.
We lasered the prefrontal cortex for 2 minutes. We did functional MRIs.
Some of these words you're getting thrown on me are out of my leg.
I know. So right here,
Right.
we lasered there, and we made changes in the back of the brain. We do a lot of stuff with the gut, because again, we're supercharging the mitochondria, and we're doing a lot of work with Alzheimer's patients. A lot of my doctors that actually work in psychology use our lasers for depression and anxiety. And then I have some other, like we're seeing chronic infections are leading to autoimmunity. So this is a study that they did on MRSA. They took antibiotic-resistant MRSA. They zapped it with a violet beam, and it completely destroyed it. This is another study on post-surgery, and they used a violet beam, and it kept the surgery site bactericidal, meaning away from infection. And we have lasers for post-surgery. But we do a lot of stuff with the brain. We do a lot of stuff with bone. Here's an interesting story. My daughter broke her arm in gymnastics. That's my daughter's arm right there. And the surgeon said that it would probably take about 6 months to heal. And I started lasering her through the cast right after surgery. And I was able to get her back to gymnastics within 7 weeks. So we were able to heal her broken arm, there's her arm, up to 50% faster, which is pretty amazing. Isn't that amazing how you can put this light on you and you don't feel it, and we can make those changes. I had, this is a great slide. What diseases are affected by mitochondria? So we're making the mitochondria work better, which is the battery to cells. So they're finding mitochondrial disease with skeletal muscle and movement disorders, diabetes, mitochondria disease, cancer, cardiac disease, neurodegenerative disease.
Well, I've got a pacemaker.
Yeah. So there's nothing electrical in this laser. Pulmonary disorders, vascular disease, aging. So again,
I got the aging.
Yeah. So we're making your mitochondria work better. And so if you, even though we're still lasering you, have you go through that range of motion. Just kind of let me move this back. So look straight ahead, and then touch your chin to your chest, and then go all the way back. And then do the lateral flexion, yeah.